risk-based capital is something which is very topical now, especially within the Nigerian context. It's something which NICOM is looking at. I think the NHI may be looking in that direction as well. But generally, what is understood is that regulation is moving into a prescriptive, moving from prescriptive to principle-based, where people are actually regulating themselves, and risk-based capital does that well, allowing people to hold the capital that is commensurate to the risk that they take. So he talked us through the experience in Kenya. Implementing a risk-based capital can be very challenging. I hope that our regulators implementing within Nigeria can learn from what has happened in Kenya, the good and the bad and the ugly, and help us implement better. Someone says experience is what you learn from other people. It doesn't have to happen to you. You can learn from other people. Otherwise, you'll be repeating the same mistakes that they've made. We also had a paper on climate risk evaluation, and I think that's interesting because it speaks to some of the broader things that actuaries are doing outside of our traditional space. Again, within the context of building resilience. To be resilient, you need to be able to withstand the things that are happening around you. And some of the things happening around us, climate risk that is becoming a big issue. And actuaries have found a way to add value in that space. So she spoke to us about some of the work that she's done, the statistical work around climate risk, and encourage us to do some more there. It all comes down to data. But then we are responsible for getting data. We're responsible for ensuring that there's better data available in that space. We then had a final paper on resilience itself, where the speaker was sharing some of our experiences and encouraging us to portray resilience. You know, one of the popular things Nigerians say is the two things I cannot do. I cannot kill myself, and I cannot come and kill myself. Those outside Nigeria may not really understand it, but basically, the person is saying, oh, there's only a limit to what he can do. But I think the speaker was trying to encourage us that we can always push ourselves and do more, because the economy, the environment right now is in such a situation where if you're not strong enough or not resilient enough, you're just going to break, and that's not how we want actuaries to be. Thank you very much. That's my recap of yesterday's activities. Like Laura said, today promises to be even more exciting. Thanks for coming. Thank you.
Thank you so much, sir.
Great. Well, I'll just announce the keynote speaker. I'll give his bio. So Dr. Kelechi Ohiru has extensive experience in the public and private healthcare sectors, spanning clinical medicine, health policy, finance, management consultancy, and advisory roles. Before his appointment as Director General, Chief Executive Officer of the NHIA, he served as a Chief Strategy Policy and Innovation Officer at the GAVI, the Vaccine Alliance, having previously held the position of Managing Director for Policy, Programme Policy and Delivery Support. He also served as the CEO of HSDF, a healthcare advisory firm, and as a visiting scientist at Harvard University. Additionally, he co-founded the Healthcare Leadership Academy and was a partner at Flint Atlantic, a social impact investment and advisory firm. His public sector career includes various roles as the senior advisor to two ministers of health and the Minister of Finance in Nigeria. In these capacities, he led the delivery on several large-scale transformation programs, such as the Saving 1 Million Lives initiative aimed at reducing maternal and child deaths, and the conceptualization and design of the National Social Safety Net program to alleviate intergenerational poverty. Before his public sector engagements, he was an engagement manager at the London office of McKinsey & Company, where he served clients across Europe, Middle East and Africa. He also worked with the World Bank Group in Washington, D.C. through the Young Professionals Programme, focusing on social protection and strengthening health systems in Asia, the Middle East and Africa. He earned his medical degree from the University of Lagos, as well as the Master of Public Health degree and the Master of Science in Public Policy and Management, both from Harvard University. He is a Desmond Tutu Fellow of the African Leadership Institute and a member of the Aspen Global Leadership Network. Welcome. Thank you.
Round of applause, ladies and gentlemen. Please resound, clap, 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 clap for him, please.
Good morning, everyone. Good morning, everyone. Morning. And thank you for the kind invitation to spend a few minutes with you today. When I was asked to do this, I wondered what a medical doctor and I guess a policy person would say to a room full of those who dealt with mathematical models, etc. But I felt that if all I achieve today is to just bring context to what we are discussing today, then maybe to some extent I would have achieved something. So forgive me, I am doing this in trepidation that you'll be looking for the numbers, but all I'll be saying are things that relate to heart and mind that characterizes the health sector. I decided not to give a speech, which is probably what a typical government official would do, and just today let's walk through a journey and give a perspective of one, how in my role as the DG of National Health Insurance Authority, we have approached the bigger picture, which is the impact we want to have on Nigerians and the role that what you do in actuarial science actually contributes and is actually critical to what we want to achieve. And we can't make that impact without you. And I hope in a few minutes we'll walk through a journey and be able to deal with that. So I think this works. Is it working? Okay. All right, cool. So I guess that's it. So the presentation will just take 4 parts. I think by way of a background, just to give an overview of health insurance landscape in Nigeria, our approach so far in addressing the issues that we face in the health insurance ecosystem. Then I'll talk about what we have done with some of your colleagues in the growth of the industry and in the transformation and reforms that we're trying to put in place. And then looking forward, what we think and how we think we can work together. So that's how I have structured today's presentation. Okay. For those who don't know, there are 2 aspects to Nigeria's healthcare system from an insurance perspective. One is largely economic and demographic. We hear very much that we have a pyramid-based population, high dependency ratios, and a high poverty rate. So what that means for me is that typically means every Nigerian now cares about how much they pay for healthcare, because about 70% of healthcare is paid for out of pocket. And the more the economy tightens, poverty worsens, the more pressure there is to look at how you can provide financial protection for all Nigerians. The second aspect of this is really our healthcare indices. We have high total fertility rates, and it ranges from about 5 children per woman to in some places about 10. We have a high infant mortality rate, and then we also have a high maternal mortality ratio. But what is also interesting is that in many countries, they went through what you call the epidemiologic transition, which meant that they transitioned from having been burdened primarily by infectious diseases like malaria, high fertility, high maternal mortality, what we're seeing. And then as they became richer, the prevalence of those issues dropped. And then gradually they started dealing with chronic diseases like diabetes, heart attacks, etc. But what we're having in Nigeria and many emerging markets is a dual burden of disease, which means that while we're still dealing with these high infant mortality and maternal mortality rates, all of a sudden, we're also being burdened by a rising prevalence of cancer, of diabetes, of hypertension, and other chronic diseases. So what that means is that we don't have the luxury of reducing spending in one in order to focus on the other. So we have to do both at the same time. It also reflects our changing demographics. People are living longer, and we're getting more and more lifestyle diseases. And so this means that the way we design our health system also has to change. So when I showed up last year into this role, we had low total coverage. Roughly about 16 million people had health insurance, any form of it. We had uneven distribution of coverage. So those who were covered were typically government workers across at the federal level and the states, and a few who worked for, large companies that actually understood health insurance as a mechanism of financial protection. The poor and the informal sector were typically left out. We had an underdeveloped market that, although we had so many private health insurance companies, etc., the risk pools were still heavily fragmented and really small. And there was also variable competency levels. Even just understanding what the business model was uneven across board. And on suboptimal quality. So people providing all sorts of packages that were not informed by any actuarial analysis. So what did we do? Well, we're under the Ministry of Health, so we derive our mandate from an overarching health sector strategy. And when the president laid this out, the coordinating minister for health and social welfare listed 4 major pillars. One is effective governance. So the places in green are where the NHIA fits into, and I'll tell you how we took this and domesticated it. Building an efficient, equitable, and quality health system, unlocking value chains in the health sector, and also health security. Most of us went through COVID, and some people were here during Ebola, so we understand the impact of and importance of health security. And then so on enablers, data and digitization, financing, and also a future fit, culture and talent within the ministries, departments, and agencies. So we realized that it was critical for us to move forward to do a few things. One, expanding health insurance coverage became, it also became my obsession, because if you don't expand that, 70% of the population will continue to be out of pocket. Second is making healthcare more affordable and accessible, implementing quality assurance initiatives, measuring impact, and then also sharing success stories, which will also serve as a way to incentivize and encourage people to actually sign up for more coverage and be financially protected. So that resulted in clarifying a vision for us, which is to improve and enhance financial access to care. 4 pillars. Coverage, which means just expanding health insurance coverage. And here we looked at it as there were 3 things that we needed to do to make sure that we could expand coverage. Of course, one is drive the mandate, because whether we know it or not, health insurance in Nigeria is actually mandatory right now. But that mandate has not been enforced. The second thing is increase awareness, because I posit that it's not just enough to make things mandatory. We don't want it to be a health tax. It should be an informed decision, because it's something you do to protect yourself. So creating more awareness amongst people. And thirdly, rebuilding trust. That trust means that in a very cynical society where we want to see the benefit derived from whatever we're paying for, people need to know that, one, if you're covered by health insurance and you show up in a health facility, 2 things must hold. One is whatever ails you that is covered, you should be able to access care. No questions asked. The second thing is that when you access that care and you're treated and you're made better, you shouldn't be asked to dip your hands in your pocket and pay anything else if it's already covered. If you break those 2 things, then trust is eroded, and then it just becomes another tax on the citizens of this country. So that trust must be rebuilt, and I will talk later about what we're really trying to do to enforce that. The second thing is equity. And why is this important? I mean, we've seen a lot of data on poverty rates in Nigeria, etc. But if we approached expanding coverage through a trickle-down mechanism where first the rich, then those in the formal sector, and then gradually trickles down to the poor, that's a policy choice. But our policy choice is that we want equity to be central in what we do. So it means that we have to be intentional. Those who cannot pay their premiums, where can governments do something about it? So we operationalized a vulnerable group fund, and then we started programs targeting different kinds of vulnerability, including women who are at risk of dying in childbirth, which is a form of acute vulnerability, given some of the indices we showed you earlier on. The third thing is about quality. Well, first, can we strengthen the use of evidence to inform design of basic things like benefit packages, premium costs, and tariffs? This was a huge problem that we had to take on, and this is one of the areas that we really benefited from actuarial advisory and work. The second is, what incentives do we provide? We can't create a sickness-based model of care, so we have to incentivize primary care and prevention, and then we have to enforce them. And then third thing, looking at the sustainability of the industry. We talked earlier on about risk pools that were so small that it was almost impossible to actually trust them to actually manage insurance on behalf of people. So what are we doing to create a more efficient and a more sustainable insurance industry? Through ensuring capital adequacy, strengthening capacity, and actually enabling equal access to the same care standards. Of course, internally within the agency, we had to look at how we engage our citizens, how we leverage data and technology, and reforming the organization. So some of the achievements were there, but I think I'll go into some detail. In the last 1 year, 1.5 years, coverage has increased from about 16.7 million Nigerians to about 20 plus million Nigerians. So almost 3.8 to 4 million people within a year and a half, and the numbers keep increasing. And I think that was sort of the highest, sort of like the fastest growth rate we've seen in a while. And I think some of the earlier factors contributed to that. We also decided to take on some of the equity programs a lot more seriously. There's something not here called the Basic Healthcare Provision Fund, where the government of Nigeria commits 1% of the consolidated revenue to primary care. Half of that goes to insurance. And then we started 2 programs. One was on women who had obstetric fistula. This was started last June, about a year ago. As at May, about 2,700 women have had their treatment paid for by government and then enrolled in health insurance after that, because treating them de-risks them and makes them insurable. Otherwise, you can't insure someone for whom the outcome is certain. But we also identified it was a government priority to crash maternal mortality. And one of the big barriers was lack of access to financing. And so what we did was, well, we'll pay for, if any woman in Nigeria presents in any of the accredited hospitals, there are about 200 plus, and the numbers are increasing. Just keep her alive, bill us, and then we can work out, the payments at the back end. And we've paid quite a lot of money for this, about over 4,000, but I think numbers are closer to 5,000 now, have benefited from this. And then we insure them and their households. And this is the government paying the premium for these people. And that was our own way of bringing equity to bear where there is market failure in health insurance industry for this. We've also looked at some other things like, HIV, people living with HIV, tuberculosis, etc., who typically are ostracized. And so this is that equity lens I spoke about. So I won't spend too much time about it. Then on things related to quality of care, one of the biggest challenges we faced was the delay in accessing care. And delays could be fatal. So we introduced certain policy guidelines. So in Nigeria now, if you're insured and you show up in a hospital and you're trying to get a referral code, usually sometimes we wait for hours and on end for it. So we've given a mandate to the hospital to, if you don't get an authorization from the HMO, treat the patient. If you don't get it within 1 hour, treat and just send the evidence to NHIA, and we'll make sure that you get reimbursed for that. So that's also to reduce, delays that we see. And we've also done a lot of work on quality, on partnering with SafeCare in quality accreditation and operational guidelines. And my colleagues are here. Dr. Agada, who heads our quality initiative, is here with us today. And then on sustainability, we started a lot of engagement with the industry, both the public, because we have about 37 subnational health insurance schemes in Nigeria, and we have at least 90 HMOs, with some also pending in terms of their accreditation. And it's very important because in spite of this number of insurers, coverage still remains abysmally poor in Nigeria. And that's because the industry was locked in a low-level equilibrium where they were stagnated at targeting only those super wealthy, super organized private sector folks. And if you understand Nigeria, you know it's an economy that is largely informal. And so encouraging them and creating the incentives to make sure that they actually target those are some of the things that we're doing, including, for instance, freezing and increasing regulatory fees based depending on how quickly you ensure that more Nigerians are covered. So there are lots of incentives and lots of policy measures that we're taking to make that happen. So just giving you a brief overview, in the last maybe year and a half, a lot of things have been happening in the sector. But one of the things that critical things we want to highlight was the need for evidence to inform our decisions and policies. A lot of that evidence was lacking because the capacity wasn't there. Particularly, we lacked actuaries in-house to do a lot of things that we needed to do. So last year I was fortunate to attend one of your meetings, and I flew from Abuja just for that, because it was very critical that we started looking at and reviewing tariffs, reviewing what we paid out in capitation and premiums and fee-for-service, etc. That was based on evidence. The last time that was done was, I think, in 2011. That was 14 years, and at that time, 13 years prior to my arrival. So it became critical to start digging and trying to understand how can we be better. Because if we don't do that, then what happens is that what we remit to hospitals in terms of tariffs, in terms of capitation, becomes suboptimal. Then that vicious cycle of care being withheld or being delayed starts, and then people begin to lose trust and confidence in the system. So over the last 18 months, what did we do? So yeah, we engaged and worked with some, I see Zamara's flyer banner there, and some others, and we began to look through, and then we're very fortunate to have Mr. Miller work with us over the last, almost a year to begin to look at this. So that resulted in us revising the capitation from 750 naira to almost doubling it to about 1,450. The same thing for fee-for-service. It was by 378% increase to that. And of course, what happened was it calmed the crisis that was brewing in the health sector. And what we did was, and I told them that when I get the data, I'm not going to massage it, I'm not going to do anything, but we're just going to roll it out. So we had a large stakeholder consultation with providers, representatives of HMOs, etc. I had a very frank discussion about this. Now that we have come to equity with clean hands and revised appropriately, it means we can actually enforce better. And so helping us generate the evidence to inform policies actually strengthens us, one, to make sure we have a health system that functions, but also from a regulatory perspective, it meant we could do more. Then we started looking at what it would cost to include and other things in the benefit package. So we had to define the mandatory minimum, and we also started looking at things. Now, in the context of, if anybody is familiar with the health sector in Nigeria, you know that we get a lot of funding from US governments and a lot of development finance institutions. And what is going on right now is what? That era is over. USAID is practically non-existent in terms of, supporting countries. And that has created a huge gap. And that means as Nigeria starts thinking, the government of Nigeria tried in the sense that they brought out $200 million, this was approved, to bridge the gap in financing because there were people on treatment and all of a sudden they were no longer on treatment because the donors that supported them had pulled the plug on those things. So the minister convened a team, we ran the numbers, and at least for the drugs, backing out drugs already in the country, we were able to start bridging the gap, absorb health workers, and do a lot of things. So that's like the immediate acute intervention. But in the medium term, what does that mean? It means we have to rethink how we finance healthcare. It means we have to look at how we can integrate these things into a benefit package. It means we can leverage the risk pools that we have and see how bringing these things into bear would actually increase access in a more sustainable way for the country in the long run. But beyond this, you actually did a lot with us, right? So in terms of the design and pricing of health insurance products, in terms of some of the financial models that were developed, so that we can project future costs, analyze trends in the market, particularly when it comes to medications. And then thirdly, in terms of helping us in terms of making sure that we have the right data to inform policy and decisions that we make were critical areas of support. So a lot has been done together, but what future do we see? And how do we see us working together? And how do we bring this to more to life? So we think there are 4 main areas that we can actually work together on. One is on enhancing this data collection, analysis, and modeling. It was painful going through the first round of Actuarial because of the paucity of data, and in some cases not even knowing the right format and the right kind of data to collect. Of course, capacity in modeling. Maybe technology will make it a lot easier now with AI and all. Secondly, in terms of developing our insurance products and appropriate and right pricing. Then 3, supporting regulatory oversight and capacity building and professional development for those in-house in an insurance agency. The NHIA used to just run a scheme, but in 2022, the NHIA Act now gave it more powers. It now also has to regulate an industry. It has to integrate all the stakeholders into having one health insurance under one roof. I think that's the language we use for it. So a lot has to be done. So when we think about data collection, right? So just list some of the things. I won't read through all of them. But essentially, it's having the right data, building the right models, collaboration, and helping us with, expert projections on long-term fiscal sustainability of the plans that we have. We do get a lot of pressure, especially political pressure. I remember one day I was just sitting down, minding my own business, and there was the legislators passed a resolution, and next thing I saw, I insure all patients with cancer in Nigeria. I was like, how do you even do that? But what helped us was data. Well, if this were to hold, this is what it would do. First, it's not really insurance, but I understand the spirit of it, but this is what it would cost. And so we now had to we had to push back, but with evidence and with data. And I think we also have to keep re-educating ourselves to understand that health insurance is part of, but it's not the entirety of health financing. And I think sometimes we mistake both. In terms of developing the basic minimum package, of course, it's not just purely technical. There's also a political economy element of this, where you have to define what goes in and what goes out, because trade-offs have to be made, particularly when affordability is an issue. The informal sector is a critical one we have to really focus on, and that's where the growth opportunity is in the sector. How do we finance and design the right products that would appeal to the informal segment in Nigeria? And then thirdly, in terms of the regional and epidemiological profiles, I think this is a critical one. Right now, we are at a point where I would say we talk about the demographic dividend a lot, where you find that the working age outstrips the non-working age, and therefore every country, and we've had examples with Indonesia and other countries, can reap this demographic dividend, because if you invest in human capital, you get that growth spurt. But in health insurance, it's also one We don't have an aging population that will consume all the healthcare resources. We have a young population. If we expand coverage, we can afford much more now than we can if we continue to wait for decades to come when the population ages. So I actually call it, this is not just a demographic dividend, this is a health insurance dividend that we can get from our current demographic profile in Nigeria. But we will not get that if we do not take health insurance coverage seriously. And if we wait until we have an aging population where medical costs exacerbate, then we run into problems that many countries are running into, particularly in the upper income countries segments. Supporting regulatory oversight is also really important. Advisory on adequate capital and solvency requirements for health insurance providers, ensuring the integrity of analysis of capital requirements, refining actuarial standards of practice for health insurance in Nigeria. So because for a long time it was not really clear who was regulating health insurance, it was pretty much the Wild West, and there are some health insurance organizations doing the right thing, but there are quite a lot who, I'll just say, had a lot to learn in terms of what they had to do. But helping us bring a principles-based regulatory framework in place is one of the things we also want to do. I think lastly, it's really about capacity building and professional development, both in-house but also the ecosystem, because I look out not just for NHIA as an institution, but also the 37 sub-national health insurance schemes, as well as the HMOs. How do we become more intentional about building capacity across the industry? And many examples exist. Do we start, with students? Do we facilitate secondments and joint projects between the NHIA and institutions? Do we collaborate on activities? From this meeting, I'm going to have a conversation with one of the academic institutions about such a collaboration. Because building that capacity and shaping an industry requires having people who actually can drive and ensure that our policies continue to be informed by robust evidence. Otherwise, we just get random policies that come with executive fiat or come from emotion and advocacy, which are not bad things in and of themselves, but that needs to be balanced with data, with evidence. And so the more people we have who can support this, the stronger an industry we have, and more Nigerians get covered. So in conclusion, we know that health insurance in the insurance space is one that's probably the least popular, the least obvious. And I don't know if you've ever had the NHIA show up at any of these meetings before. Has that ever happened? No. And that's particularly because, in the evolution of the healthcare industry in Nigeria, the way we have approached health insurance hasn't been based on the foundational principles of insurance. We've come at it from more health and less insurance. And what I'm saying here today is not more insurance or more health, but the right balance needs to be struck. And the NHI remains committed to changing this narrative. And we also have a responsibility to make the health insurance industry not just thriving, but also more attractive to actuaries and actuarial science students, so that you can consider a specialization in health, because it does affect all of us and it's very critical. Because we feel that if we build this together, it will in many ways contribute towards Nigerians' goal of achieving universal health coverage. And I think that is really the message here today. Health is too important to leave in the hands of just doctors. It means that we need to lean in and make sure that the policies that affect you and affect me are grounded on the right evidence. Insurance has a role to play. In the new world, we see ourselves as we want to finance healthcare in Nigeria for 200 plus million people. Particularly what we've seen in changing geopolitics. The era of someone coming in and paying for healthcare for Nigerians, that's pretty much over. The era of people paying for healthcare when they are sick at the time of illness, when they need care, should be over, because that's not sustainable and is regressive. So that means we have to think of better ways of financial protection, and health insurance offers that. So I hope that this is my advocacy field, that you look more into that, and let's see how we can collaborate more to help Nigerians have access to better care. Thank you very much.
Thank you. I think we've got time for a couple of questions. Does anybody... Sorry.
All right.
Yes, thank you very much for your presentation. I remember 2020 when my wife gave birth. Then ASU was on strike and we're on lockdown. There was no money and my wife was to give birth. So I took her to hospital. She gave birth. I was waiting for the bill. I had to go and borrow 10,000 naira in case. Let me start with that one. But when the time came, they told me that I paid 800 naira. They said, I've paid. I said, how? That NHIS, it was NHIS then. So I still had to keep the money for some days in case they forget and call me back. I have been teaching a course on NHIS, but not this Nigeria. Theory is different from practice, but it is like in the case of NHIS, theory is practice. So thank you for that. However, I have some concerns, maybe 2 or 3. The first one is the aspect of informal sector, which you talked about. I need more light on the efforts of NHIA now to capture people like the mechanic, the wheelbarrow pushers, who may not afford the cost of health, especially in the current Nigeria. So I need more light on that. If there is effort there, is there awareness? Are those people aware about it? And then my second concern is the aspect of inflation. What effort is NHIS making to control the effect of inflation on the cost of NHIA? Because I observed that for these past 1 or 2 years, due to inflation, the drugs that they were normally giving patients for various illnesses have reduced. At a point, you have to go out to buy the drugs. So what effort is NHI doing about that? These are my concerns. Thank you.
Thank you. So we'll just take a couple more together and then respond together.
Yeah, thank you, Mr. DG. Good morning. My question is on finance. You talk about financing healthcare, and I think you know about the Nigerian State for Health Investment Project. And this Nigerian State for Health Investment Project has been targeted towards maternal and child mortality to increase the health of child and mothers. So this Nigerian State for Health Investment Project, are they working in collaboration with NHIA in terms of giving insurance coverage for child and mothers? That's what I want to know about that. Or if peradventure the Nigerian State for Health Investment Project is actually working on their own in isolation with the NHIA. Thank you very much.
Thank you.
Okay, just one. Sir, who is the chosen one between both of them?
Take half of his question and half of his question.
Good morning, sir. It's a nice presentation. So, as you said, you recommended half of my question, so I'm going to give half to him also. I just want to know, coverage, UHF, USC coverage, definitely NHIA cannot do it alone. Do you have any synergy working with the state's healthcare authorities? And in the case of the informal sector, are you looking at the area of kind of exchange, product exchange, in terms of product premium payment, product in terms of the informal sector, giving you a product in exchange for token they pay? You know, that could also encourage them to be part of it.
The other half, yeah.
Thank you, sir. I have two questions. The first one is regarding the effort NHIA has made in improving coverage or in massively expanding health insurance coverage in Nigeria. However, I would like to ask whether the same effort has been made in improving the supply side of care from the other side. The second question is regarding the quality of care, especially in facilities that were affiliated to NHIA. Whether the quality of care is up to the standard or not. Thank you.
Thank you very much. Excellent questions, and deeply grateful for the questions that you've asked. It shows that, you know, hopefully, like what I presented, you know, didn't just land on people saying, what is this guy talking about? One of the things that I've noticed every time I show up in a meeting is the personal stories of people, right? I once went for a meeting, had nothing to do with healthcare. And it was about the social protection agenda of the government. And I walked in there, and the minister was on a panel with the Minister of Budget and the Minister of Finance. And the anchor, the moderator, immediately just shifted to health and to health insurance. And this same question about somebody ill and the medical bills and everything, and this was had nothing to do with healthcare. And the minister was like, thank God, the DG of NHIA is right there. And he pointed at me. And that is what happens in every meeting. You go in, and then, because it's something that is not just theoretical to many, it affects people personally. So that's why we take it very seriously. And I'm glad you had a decent experience, right? In some cases, it's not the same for many people. Some people do not have health insurance coverage. And the reason why we approached what we did with regards to maternal mortality was, if you wait until you cover all eligible women in Nigeria, a lot of lives will be lost. So that's why we had to come with a policy decision and just make it a blanket statement. If you show up, you can't pay, please, hospitals, treat them. And we've gone from state to state, working with the states governments, all the states in the country, about 200 plus referral centers are actually implementing this. So that when the woman shows up in that 48-hour window that is just life or death, treat, and then insure them after. So that any subsequent illness related to childbirth or not is catered for. And so that's what we're trying to do. The informal sector is a big one, and it's not going to be an easy one to crack. We've had several conversations with the ILO and with all our partners and looked at other examples. And there are a few things that we have to hack, so to speak. One is, how do you organize them to pay? And so working with trade groups, right? So we have conversations on our board is, what's the organization again that represents, NECA is on our board, the labor union is on our board, so that we can find good ways of organizing people to pay, because there are certain things when you come to paying premiums for the year and trying to avoid, you know, moral hazard and adverse selection, which are two market failures we deal with. So bringing them together and organizing them using the associations is one way we're going to do it. Second is the way you pay. Typically, people pay their premiums annually. If sometimes they pay monthly because it's linked to your salaries. The informal sector doesn't earn that way. Sometimes people earn daily. They might have a big month and another month might not be that great. So how do we work with fintech, etc., to look for a way to address that payment question? And there are lots of ideas that we have started to look at and discuss and pilot. Time won't allow me go into a lot of detail. But that's one of the things that we have looked at. And yes, we do collaborate a lot with the states. And the data presented is the data for the industry, not just NHIA. Because one of the things we're trying to do is stop the fragmentation and see ourselves as all rowing in the same direction for coverage. So I will celebrate the success of Lagos State Contributory Health Program. I will do the same for Kano elsewhere. I feel like, and I told them in a meeting, I'm like, we're still at 10% coverage. Let's start fighting when we get to 80%. Right now, there's a sea of opportunity out there. When we get to 80, 90% layers there, we can start getting selfish. But right now, we must collaborate to get to where we want to get to. Inflation is a problem, and one of the reasons that we brought in the actuarial review was to reflect reality. Cost of drugs have gone up significantly, and medical inflation usually outstrips the regular inflation. And so this was one of the things that we had to do in reviewing, and that's why this will be reviewed periodically according to the National Health Act. The supply side is a problem. There are people responsible for that, but what can we do? We are strategic purchasers of care. So that means we need to do a few things. We need to define quality metrics that we want our enrollees to access. So we have partnered with SafeCare to standardize accreditation standards across the country. And in fact, right now as we speak, about 170 NHI staff are undergoing quality retraining with the Society for Quality in Health to make sure when we go and accredit a facility, we all see what it is. And we have to hold the line on good quality care. There are challenges, particularly in parts of the country where you don't even have facilities there. So how do we balance that and make that happen? But quality on the supply side is critical, and we partner a lot with the National Primary Healthcare Development Agency for primary care. So we have similar quality standards, and we harmonize some of those things. I think I've covered most of it. I think I've covered most of it. If I haven't, please grab me afterwards, and I'll be happy to provide any clarification. Thank you.
We'd like to present you with a gift as a sign of our appreciation. And I understand we want to have a quick photo. Is that possible? Sure. Yeah. I think if we do it here, it might be easier. Yeah. Should I try?
We are saying cheese. Everybody cheese. Thank you very much, sir.
Okay, thank you very much. We're going to move on to our first session now, Adventuring Beyond Your Comfort Zone. This will be given by Amanda Rose Huck, who's the president of the Society of Actuaries from America. Amanda became the 76th SOA president and chair at the 2024 Impact Conference, the SOA's annual meeting. She is a director in Willis Tower Watson's insurance consulting and technology practice, where she leads the New York office of Life Actuaries and supports clients in the transformation, analytics and litigation space. She previously worked at Mass Mutual as Chief of Staff to the CFO, among a variety of product development roles. During Amanda's 2020 to 2023 term on the SOA Board of Directors, she chaired the Governance and Policy Committee and Task Force for Evolving the FSA Pathway. She also served as a member of the Strategic Plan Task Force and as a board liaison for the Young Professionals Advisory Council and the Diversity, Equity and Inclusion Committee. Amanda is a past president of the Actuaries Club of Hartford and Springfield and the Actuaries Club of Boston, and she graduated first in her class with an MBA from the University of Chicago Booth School of Business. Amanda enjoys adventure travel, and she's been lucky enough to swim to the edge of Victoria Falls, cross paths with the Big Five in South Africa, and hike the W Trek in Patagonia. As a committed Christian, she holds a Master's in Divinity from the Gordon Conwell Theological Seminary and is active in a local church in New York City. Please can we give a warm welcome to Amanda.
Round of applause for Amanda.
Good morning, everyone. As she said, I'm Amanda Hugg, President and Chair of the Society of Actuaries, and it is an honor to be here with you in Nigeria. I've had the privilege of traveling to many other countries in Africa and always find it one of my favorite places to go, but this is my first time in Nigeria, and you all have just been so warm and so welcoming, so thank you. So I was excited when I heard that the conference theme was about resilience, because for me, I have made a habit of building resilience by stepping out of my comfort zone and adventuring. I often say I am an actuary who loves adventure, and it's not lost on me that as someone who manages risk for a living, I also love risk taking. So I thought I could talk a little bit about some of my adventures over the years, and then I want to talk about how the SOA is adventuring beyond, and we're building resilience by stepping outside of our comfort zone. And you heard a little bit about some of the adventures I've taken, but I always think it's more fun to show my adventure. So I'll show you here. Let's see if this is going to work. Thank you, thank you. All right. So can we go to the next slide? There we go. Okay. So when I tell people about the adventures or show that the adventures I've been on, they always say to me, Amanda, you're so brave. But I'm going to let you in on a little secret here. I'm not actually that brave. I just do things scared. Because I believe when you do things scared, it builds resilience and it makes you stronger for the next time. And so if I imagine my life or you imagine your life on this imaginary scale of 0, not scary at all, to 10, terrifying out of your mind, you don't have to go from 0 to 10, right? You can go from 0 to 1, and then 1 to 2, and then 2 to 3. And that one step is actually, you realize you can overcome it. You are resilient. And then eventually you're going to be at a 7, you're going to be at an 8, and you're going to look back at the 1 and think, that's not scary at all, right? And that's what happens over time. And so I would just encourage you, as I'm going through this, think about what are those things in your career or in your personal life where you want to build resilience. And maybe you have this big goal that you want to work towards. And what is that one step that you can take today that's just like a little bit out of your comfort zone? I'll tell a few stories here about how I've built some resilience. So the first is scuba diving. So you saw at the very end, scuba diving. I was traveling to Australia and feeling very lucky that I had the opportunity to scuba dive on the Great Barrier Reef. And if anyone knows scuba diving, you have to be certified. And so I signed up for a class near my home in the United States, and I had to go every week to practice scuba diving. And this was one of my first really gonna be big adventures. And I remember I was so nervous about the class that I would actually feel sick to my stomach as I was driving to the class each time. And here's the thing about the training, is that you're training in a pool. So I was so nervous, but I was in a pool about 4 feet deep, clear water. There was no risk, really. But I pushed through my fear because I knew that it was going to be an incredible experience once I got to Australia. And again, it was obviously an amazing time to be down there with the fish and see the colorful reef, so it was definitely worth it. So then once I had built some comfort, I said, you know what, all right, let me try another step, maybe a couple steps out of my comfort zone here, and let me try skydiving. And this is the picture I always show them when I want them to think that I'm really brave and really cool, because I look like I'm having the time of my life. But again, I'm gonna let you in on a little secret. Here's how I actually looked when I jumped out of the plane. Terrified out of my mind, okay? And when you skydive, thank goodness you jump with an instructor, and they're really the one who jumps out of the plane, because if I had to jump out myself, I don't think I ever would have gotten out. And that's my other secret about building resilience, is pre-commit to the thing that you want to do. Pay the fee, sign the waiver, put on your jumpsuit. These are all things you do on the ground before the real fear kicks in. And then once you're on the plane, you're going whether you like it or not. So whether that be wanting to present in front of a large crowd, or wanting to take a new role, or wanting to do something personally that you've never done before, what is that thing you can do when you're in a less scary space, right? So that you know you'll actually make that decision. And I've taken this same approach, and obviously it was a great experience. I was screaming out of fear and excitement, right? So a little bit professionally about how I've done this. It goes way back when stepping out of my comfort zone was saying, I'm gonna take these difficult exams to become an actuary. Anyone who's a credentialed actuary knows that this is a challenge, and this is me camped out in a coffee shop near my house with probably every book I owned. I would do that for the full week before the exam. And so if you are in this room and you are still writing exams, know that you're not alone. You have a community around you, some who have been through it, some who are in it, and each exam you take, you can think about the exams like on a scale of 1 to 10. Each exam you take and pass is going to give you that courage to look back and that resilience to say, I did that. I am capable of this, right? So just remember that when you're in the throes of it. So then I said, all right, I finished my exams, let me start volunteering. And volunteering is such a powerful way to get out of your comfort zone with really low risk, because you're not getting paid for it, so no one, your job is not gonna be on the line because of it. And it's a chance to meet people, it's a chance to network. So I started volunteering with my local actuarial club near my city in the United States, and that was out of my comfort zone because I had to interact with people who worked at different companies in different practice areas that I didn't know anything about. I had to start getting on stage. It's quite a large club. There was about 400 members that came to our meeting, so I had to start getting on stage and making short presentations, and that was all scary, but I did it, and it was good. I ended up being president of that club, which was an honor. And so then I said, all right, let me start to think about volunteering with the Society of Actuaries. And so I ran for some smaller committees. I got to know people around the United States, which again, out of my comfort zone. They're often people many more senior to I. But that was a great experience. And I looked at the board and I said, there's not a lot of representation from people in my generation, from millennials. And at first I thought, maybe I'll wait to run for the board. Maybe I'll wait like 10 years until I look a little bit more like everyone else in the room. And I had a senior leader say to me, Amanda, your voice is unique now. You should run for the board now. And so think about, what is that unique thing that you're bringing and you could bring to volunteering? And so I ran for the board. It was a great experience. I was on the board for 3 years, and that's when I decided to run for president and chair. And it has been an honor to travel around the world and represent the SOA in this role. Thank you. All right, so that's me. So let's talk about the SOA. The Society of Actuaries is the world's largest actuarial organization. We have 35,000 credentialed members, and we have about 30 to 40,000 people taking our exams globally. And I've noticed that in some of the bios of our members, they will say Society of Actuaries, parentheses, USA, which I love, and that's great. But from my perspective as president, the Society of Actuaries is a global organization. We have 35% of our members are outside the United States, and 45% of our candidates are outside the United States. So yes, we are headquartered in Chicago, Illinois, in the US, but we actually have offices in Beijing, Hong Kong, Singapore, and Dubai. And in each of those areas, we have a regional director who reports to Andy, our managing director, Andy Peterson, our managing director of international relations, and those managing directors serve different regions. So some of you last year may have met Zan Ibrahim, who's our regional director. He's based in Dubai, and he's responsible for the Africa region. And so he's the person that will be on the ground working with NAS, visiting with you, talking to your stakeholders. And so we really take our global identity seriously, and we want to meet the needs of what's happening for you here in Nigeria, just like we meet the needs of our members in the United States. So our purpose is to empower our members, that's many of you in this room, to drive solutions to life's financial risks. And right now we're thinking about 3 priorities for our strategy. So the first is to optimize the candidate to member pipeline. So what this means is we know that we have a long pipeline of people coming into the profession, and then it takes a long time sometimes to get to your associateship or your fellowship. And so we are talking to our students and candidates and saying, how can we make that experience better? Is the content that's in that pathway relevant for you in your jobs? And then we are making updates. And so I'll talk a little bit about some of the fellowship pathway updates we are launching in about 3 months here. The second is grow globally. So we continue, about 15 years ago, I mentioned those 4 offices. About 15 years ago, we only had 1 staff member outside the United States. And now we have almost 20 staff members outside the United States. So we're really looking to continue to make sure that our products and services are relevant for what you're facing. And then third, leverage artificial intelligence. As actuaries, we know that the skills that you need to do your job will start to include AI, right? That's a tool, and we've heard that a lot at this conference. And so we're making sure that we are putting AI into our professional development content, at our meetings, in webcasts, to make it relevant for you. All right. I wanted to mention, in case there's anyone in this room who is not a credentialed member, we have an affiliate member program. And what this is geared at university students, it could be high school students, it could be professors, it could be parents, anyone who wants to know more about the actuarial profession. And we launched this program 3 years ago, and it's grown to 30,000 members globally, which I think means something is working, and there's some value that we're adding through that. And we actually have 210 affiliate members here in Nigeria, so I was really excited about that. I talked to a bunch of students at Unilog on Tuesday during their Actuarial Summit 2.0, and I said, I hope after this speech we go from 200 to 400. So we'll check the numbers when we get home. But what this offers is peer-to-peer networking. It offers mentoring. It offers lunch and learns, like how to build your resume, how to interview, how to be successful in exams. It also offers free practice courses for our exam probability and our exam financial math, so that you can practice that before you sit for your first exam. And so we're excited about this. We think this is a really big benefit to those that are in the profession. It is completely free to join. We also have regional marketing, and so we are branding our brand, and I saw this on some other banners as well, that math is a superpower. I've heard a lot from university professors, from the panel, awareness is a challenge. And frankly, that's the exact same in the United States. If you look globally, there's about, and you look at doctors, there's about like 10 million doctors globally. There's like maybe a little under 100,000 credentialed actuaries globally. So it kind of makes sense that doctors have a better reputation and are more aware, right, than actuaries. But we want to change that. So we have a regional marketing campaign aimed at 18 to 22-year-olds. And here's an example of one of our members who actually was the first fellow in Saudi Arabia, a female fellow, and she is featured in this campaign. I'm going to go back.
I'm the first female actuary in Saudi Arabia with a fellowship designation. My ultimate goal is to make an impact in people's lives, to identify the opportunities that actuaries can contribute to public.
All right, so that's our marketing campaign, so we'll continue to roll that out in different regions. So I mentioned this idea of listening to our candidates. So one of the things that we heard from our global members is about our fellowship pathway. Previously, our fellowship pathway required you to get your FSA, Fellow in the Society of Actuaries, in a specific track. So you could either do the life track, or you could do the investments track, or you could do the health track. And when we traveled around the world and we talked to our members in emerging markets like Nigeria, what they said to us is, SOA, we are jacks of all trades. We work across all practice areas. When we're at a company, we are the actuary, right? We can't specialize in just health. We can't specialize in just life. My boss needs me to do everything. And so what we're doing is we're getting rid of the track system, and we are saying, you know what? You can take 4 courses and you can take them in the areas that are relevant for your job that you're interested in. And so we do still ask 2 of them to be in the same practice area, so you're building some depth, right? But then the other 2 can be in whatever you want. So maybe you say, you know what, I spend most of my time on motor insurance, so I'm going to do 2 exams in general insurance to really build that. But then I do a little bit of life and I do a little bit of health. So I'm going to do an exam in life and health, right? Or you could say, you know what, I actually really only do life insurance, so I'm still going to do 4 in life insurance. That's fine too. So really, this is an example of our Grow Globally mission, is we want our pathway to be relevant for you. The other thing that we're doing, and we heard when we traveled around the world, is, Amanda, why do I have to learn US GAAP if I work in Nigeria? And that's a great question. So we said, you know what, let's take that really detailed US regulatory content off. You can still do it if you feel like you're gonna move to the US, or you feel like maybe you work for a global multinational or something like that, or you can just bypass it altogether and say it's not relevant, I'm not gonna study it. And so we're really trying to make these updates. They come this fall, so for those of you that are working on your path, when you get to the fellowship, that'll hopefully make it a bit more relevant for you. And then the last thing is, we also hear from our candidates everywhere in the world, why does it take so long to get my grade? And so what we're doing is we are shortening the exam pathway, the grading time from 11 weeks down to 4 weeks. Okay, so people who take fellowship courses will get their results in 4 weeks, which we are really excited about. Oh my goodness. All right. We are also making an effort to travel around to all regions and visit our members and candidates where they are. So this is us in Nigeria. Last year for NAS, we've been coming for a while now. Our past president, John Robinson, had the privilege of being here last year and just had a great experience, as well as our regional director, Zan Ibrahim, is in some of these photos. And then this week in Nigeria, Andy and I are here, and like I said, we got to go to Unilog, and then we also had the privilege of hosting professors from about 10 different universities around Nigeria that have actuarial science programs. And we got to hear directly from them. What are the challenges that they're facing? What are the opportunities? How can we help them as the SOA? And so we're grateful to NAS for partnering with us on that event, and that was a great opportunity to meet the people here in your region that are training up the next generation of actuaries. All right. I wanted to just highlight some of the research that we do. The SOA is an education and research organization. We do probably the most research of any actuarial body, and we consider that a core part of the value proposition we bring to our members. And we are really, again, growing globally and trying to make sure that research is relevant. So the middle one here is an example of a research project that was done called Microinsurance in a Nutshell, only in Africa. And then the other two are articles that are in our flagship magazine, The Actuary. So I mentioned John Robinson, our past president, came. After he did that, he wrote an article about the actuarial profession in Africa and the growth in this region. And so encourage you, also free, check out these things online if you're interested in our research or our thought articles. All right. So to wrap up, I just want to make a plug for volunteering. The SOA has 35,000 credentialed members globally and 4,000 volunteers around the world. Volunteering has been the thing that has been the most meaningful in my career, built a lot of resilience for me. And if you're not volunteering, I encourage you to volunteer. And I will say, SOA is fine. Volunteer for NAS. They are doing amazing things on the ground here, and we are partnering with them. And so if you're volunteering for them, you're essentially becoming part of the SOA as well. So definitely consider that if you haven't had a chance to do it yet. All right, this is not okay. All right, so to wrap up, I believe that one great way to build resilience is to step out of your comfort zone, one step at a time, with your end goal in mind, but doing things that are not too difficult today so that you can get to that place into the future. Thank you so much for having me.
Thank you so much. Any questions? Questions? Okay, I don't think anyone has questions for her.
Are you sure this is the SOA president? So if you want to grill any questions, this is your opportunity. Okay. So we'd like to present you with a gift as a sign of our appreciation. The gift. Yeah, and the QR code, please. The QR code. Can you take this? I'll go get the gift.
Thank you, Laura.
Thank you very much. So we're going to move on to session 2, which is a presentation on the NAS initiatives. So I'd like to invite our NAS CEO, Yezide Gebenro. She's the managing director of NAS. She was previously country manager for QED Actuaries and Consultants for over 5 years, and before that an actuarial consultant at Alexandra Forbes Consultancy. She has an MBA as well as a bachelor's degree in actuarial science from the University of Lagos. Thank you very much.
Thank you very much, Mrs. Yesidi.
Thank you very much, everyone. Thank you for coming for the conference. Thank you for making it. So I'm just going to start with what Amanda said about volunteering. Very interesting fact. I started, before I joined NAS as the CEO, I started with volunteering with NAS. I know that everyone who knows me, they know that I'm a very passionate person. I always have a cause I'm passionate about. And so everything I do, I volunteer for it. Last year, I volunteered. I was the chairperson of this conference. And then I started working with NAS. And, you know, here I am today. So I'm just going to talk a bit about what we've been doing in the Nigerian Actuarial Society, what we've done in the last year, what we're doing now, and our plans for the future. Yeah, so I'll just start with first, the year in review. Sorry, just want to. Okay, so I'll start with our year in review. I'll say that the things that we focused on this year, in the last year, we focused on 5 things: mentorship, education, collaboration, outreach, and our processes. So I'll start with the mentorship part. This year, sorry, give me a minute. Okay, so this is the agenda. These are things I'm going to talk about: the year in review, our current initiatives, opportunities to engage with NAS, and partnership with NAS. First, I'll talk about our mission and our objectives in NAS. Our mission, which is like the most important part, is to bridge the actuarial gap in Nigeria. Our objective is to advance the knowledge of actuarial science and also promote the maintenance of high standards of practice and conduct within the actuarial profession. Also, vision is to make actuaries the most trusted and sought after professionals in Nigeria. So, like I said, this year, in the last year, we focused on five things: mentorship, education, collaboration, outreach, and our processes. Yeah, so these are things that we have done in this last 1 year. On mentorship, last year kicked off with our annual mentorship program. So we have a partnership with Milliman in the United States and the GAIN initiative, which is an initiative that is put forward by the United Nations Development Program. They'll speak today, so they'll talk about it a bit in the afternoon. Yeah, so we started it in October 2024. We had 25 people register, people working and students. We we streamlined it. We cut it down to 14 mentees and 11 mentors to mentor those 14 people. These mentors were from the UK, Germany, US, and Kenya. So we did a call out for people to volunteer to mentor students from the Nigerian universities. Under education, we started our Exam P tutorial in October last year. We had 300 students from across different campuses in Nigeria register for it. Last year, it was, the previous one was about 224 people. We had 44 people enrolled. That's after we did a test. At the end of it, we did I think 3 months of rigorous tutorials. After that, we wrote a mock exam. And we had so many people pass this exam. So we had initially planned to sponsor 5 people for the exam, but because of, you know, the way that they performed, we had to sponsor 12 people. Out of the 12, we have 7 of them that passed the exams, which is different. I mean, in the past, we had just 2 people pass, but then this one we had 7 people pass. Because like I said, we had very rigorous tutorials during weekends, sometimes during the week. For students, we had people volunteer to take these tutorials. It was online, by the way. We also, lent the students calculators, because we know the calculators are quite expensive for the exam. So they used it to practice for the exams. And the 7 people, some of them are here today. I mean, yeah. So the thing about it is when you pass one of the exams, you automatically get sponsored for the next exam. So for those 7 people who passed, they're automatically enrolled for the next exam FM. And we started the exam FM tutorial session in March this year. We had 300 registrations also and enrolled only 44 after a test. We have done the mock exams and we have 5 people to sponsor. Now, out of those 5 people, we have some of them who had passed exam FM. Sorry, out of the 7 people who we sponsored for the exam P, we had some of them, about 2 of them have passed the exam FM. So we have about 5 extra people to sponsor for exam FM. So we have 10 people that we're sponsoring for this August cohort. Like I said, some of them are there. We also hosted about 5 CPD sessions between September 2024 till June. The first one was the general insurance skills for modern actuary, and we had our partners from Milliman. Some of them volunteered for this CPD session. Same thing with the second one, which was the day-to-day role of an actuary working for a regulator. We had one of the insurance regulators in the US, give this CPD session. And we did an introduction to parametric insurance in January. And then we did loss reserving, understanding loss reserving also from, we got this CPD session from Milliman. They volunteered for it. And then this June, early this June, we had a webinar for students, which was Pathways to Qualifying as an Actuary. Also, we have had strategic engagements with NICOM, NHI, and FRC. They have released guidance notes on the FCR. And we have drafted our responses and assisted with that, the regulatory requirements for writing annuity business in Nigeria. And I'm happy to say that, everything that all the comments that we gave them, they took it on board, and then they released this regulatory requirements. Also, we helped with the risk-based capital draft regulations, which are yet to be released, the final one. We also helped with the solvency control and intervention framework. Now, we also assisted the FRC, the Financial Reporting Council, to adopt the ISAPs, that's the International Standards of Actuarial Practice in Nigeria. And so they came up with a law, which is the Nigerian Actuarial Practice Regulation. We only have the draft yet. They've not released the final copy, but we sent our comments to them. Now, in all of this, it's not just us in NAS who worked on it. We had a lot of people volunteer for this roles because we can't do it alone. The next slide was, we also had a collaboration with TASC, which is the Actuarial Society of Kenya, and Actuarial Society of Ghana to jointly present at Convention A. We had one of our council members who is also here, Mr. Ganiu. He presented on behalf of NAS. So it was Convention A. It was a convention put together by ActuView, which is like the biggest actuarial streaming platform in the world. And we had a lot of good feedback from it. Now, we visited secondary schools for outreaches. We visited the University of Lagos also. We talked to secondary school students about actuarial science and, the benefits of studying actuarial science. We also did, little quizzes for them and gave them gifts. That's math quizzes for them. Then in NAS, we reviewed our processes. We made paying for subscriptions easier and all of that. We are also upgrading our website, which I'll talk about in a bit. So this is just one of the testimonials from the mentorship program. This is Toby. She also works with NAS. She says, the NAS mentorship program has been instrumental in my growth. Thanks to my mentor, David Stoddard, guidance and patience, I've learned valuable traits like punctuality, which has had significant impact on my productivity. Together, we set clear goals for the program and walk through them step by step. I also gained essential skills in Excel, and my mentor provided constructive feedback on my CV. His support went above and beyond, and I am grateful for the experience. We also had a testimonial for somebody we sponsored from the exam P. He says, my name is James Ezekiel, and I recently passed my first actuarial exams. It was a roller coaster of a journey, one that demanded deep focus, total commitment, sacrifice, determination, and above all, God's grace. Preparing for exam P required me to face it squarely. It shaped the way that I study for exams, pushed me beyond my limits, and tested not just my knowledge, but my resolve. I'm incredibly grateful that I succeeded. To anyone preparing for exam P, here's my advice. Give it your full focus, dedicate enough time, study time, prepare thoroughly, and on the day of the exam, working with confidence, and you've got this. So he was sponsored for exam P. He will be sponsored for exam FM also, the next one taken. I'll just talk about the actuarial landscape. And these stats are from NAS, registered stats. We have our supply of actuaries. We have about 35 fellows registered with NAS. By the way, not this number, most of them don't live in Nigeria. We have very few living and working in Nigeria. That's 35 fellows, 11 associates, 104 analysts, and over 1,000 students cut across over 8 universities. But then the demand, we have about 56 insurance companies. Very soon, NICOM will come up with a requirement to maintain an actuarial function in-house, and it has to be compulsory. Then we have different innovations going on in the insurance space, the IFRS 17, the risk-based capital, and so we have an increasing demand for actuaries, but very few actuaries. What do we do to bridge this actuarial gap? First, the SOA exam P and FM tutorial sponsorship. That's what we're doing now. We have plans to do 2 of each cohorts per year. So 2 exam P cohorts, exam FM cohorts. Now, the way it works is that we do tutorials, very rigorous tutorial sessions for students. It usually takes place weekends and some days, sometimes weekdays. We have people volunteer to teach these courses. We even have somebody who has volunteered from Pakistan who teaches courses to students every weekend. Yes, we also have a university engagement program. First of all, the UNILAG, the IFOA Masters program. NAS provides, registered members of NAS are adjunct lecturers. They take these courses for the Masters program in the University of Lagos, and we're also looking for more adjuncts. So, I mean, if you can sign up, we would really like that. We also coordinate, because we know most of them are working, and then they're also teaching. So what we do is we coordinate their schedules for them. When they want to teach in the University of Lagos, we have their schedules, we send it to them, we set up the classes. Most of the classes are online, so we set it up for them. Then we assist with universities, the VE accreditation for universities, and I'm happy to say that we worked in conjunction with ADA this year, and we were able to, and then obviously with the tenacity and the, I don't know the words to use, but then the determination of one of our lecturers here, we're able to get a VE accreditation for a university, the University of Jigawa State in Dutse. Please, so you see a university in Nigeria is already VE accredited. Congratulations to Dr. Naz. He was very determined and then he got it. So we assist with all of this. We point you in the right direction. Then we do CPD and trainings. These CPDs count towards your like professional development and all of that. We train companies, staff. We train students also that are writing exams. The regulatory partnership and collaborations, like I said, we collaborate with the regulators. We have this discount rate committee where every month we have a lot of NAS members that are on it. We help with discount rates for companies to use. We also are part of the mortality committee. We were trying to develop a mortality table for Nigeria. NAS is part of it, in conjunction, of course, with NIA, NICOM, PENCOM. Then we're upgrading our membership portal and website. So we're trying to make it easier for people to register for events, register as members of NAS, pay your subscription, information. So we were hoping it would be ready by today, but unfortunately, we didn't meet the deadline. But in the next couple of weeks, we'll send the message out that our website has been upgraded. So you're able to log in. You have a member portal where you log in, you put in your information, you can put in your profile, and then you can pay directly for your subscription rather than sending emails and asking for invoices. You can pay for conferences, you can volunteer, you can put your papers online, whatever you want to do with our website. Then we also are currently still doing secondary school tours. We visit secondary schools to introduce the younger students to actuarial science early in the academic journey. And then we recognize outstanding talent from this. Like I said, we do math competitions. And then, currently we're trying to get a charter. I mean, we have a lot of government agencies that say, well, you guys need to get a charter. We're currently working on it. Please, if you can scan the QR code. If you want to see our bill, this is our draft bill. You can just scan it and then you can read through it. It was drafted with the help of one of our partners, Milliman. They helped draft it. And we have sent it to the regulators. We've sent it to NICOM. We've sent it to FRC. They've given us their feedback and all of this. So we are currently working very, very hard to get it, to get a charter, hopefully by the end of this year or early next year. Also, like I said, we're upgrading our website, so look forward to it in the next couple of weeks. We'll send a communication to you about this. So what's coming next? So we are currently working, and I know that we got a lot of feedback from the lecturers event on Tuesday about internship. So we're currently working very closely with the CIN to develop an internship program for university students across Nigeria. This time around, it's not just going to be University of Lagos. Other universities are going to be included in it. We will roll out the program in the next few weeks because we're trying to see if we can do the summer program. We're trying to work with companies to get an internship program for students. Then we also want to start a formalized mentorship scheme. Like I said, most of our mentors this last one, were from the US, the UK. We want to get more Nigerians involved in, we have, like I said, we have 35 Nigerian actuaries. Even though they're not here, they're able to register. We have associates that can mentor younger people, younger students. Then also we want to collaborate with other universities to develop the actuarial science program. I'm very glad that the SOA we put together and ADA we put together this lecturers event on Tuesday. And we got everything that they said, and we want to help out. So we want to help with the VE accreditation. We want to provide laptops so there are more practical sessions in universities. People are able to develop models in classrooms. Then also we are launching a newsletter in the next couple of months. You can get that online. Then also we want to, one of the feedback we got from the event on Tuesday was the prometric centers. We have a lot of universities outside Lagos. And it's quite expensive for them coming to Lagos to write their exams. So we want to see if we can assist with that. Get a center accredited in Abuja or in the north somewhere. Also, we want to see if we can do an actuarial library in Unilag. We have the space already. We just need the funds to build this library where students are able to study for exams. They have laptops where they can study for exams. And then we want to have a directory publication. Everyone knows where the actuaries, companies are able to contact actuaries directly. So we want you to volunteer with us. As an individual, these are areas that we would like for you to volunteer with us. Mentorship, like I said, please, you don't even have to be a fellow and associate. You just have to, want to instill something in someone. So please, you can sign up for our mentorship program. You can sign up to be a speaker at our CPD sessions, a trainer for webinars. Also, we have a working committee where we draft regulations, where we comment on regulations. When we get, the regulators send us regulations and ask for our comments, we need some people to help with it. Also, for education, we need tutors. Like I said, we have a very robust program for young actuaries in training. We need people that will tutor them for the exams. Then we need trainings, also people that will help with trainings, and then we need adjuncts, like I said, lecturers, adjunct lecturers for universities in Lagos, outside Lagos, people who will give their time to lecture students. And then we also need people for content development, newsletter, journal, social media, and then our awareness champions. You need to preach the actuarial gospel all around. Then for corporates, we need, obviously we can't do this without the corporates, with the companies. You guys, most of you work with insurance companies, and many of you are like in top positions. You can also like help with internship placements for students and for people. For example, sponsorships. You can decide to sponsor a whole cohort of exam P and FM. We want to make it bigger. We don't want to sponsor just 10 to 12 people. We want to sponsor more people. We want to start a fund where companies are able to put in money in the fund, and we're able to sponsor more students. Then also hosting events. We have a lot of webinars and events. We need people that will help us host these events, your companies for trainings and all of that. Then also donation of resources and tools. Like I said, a lot of universities, they need laptops. You can't be writing models like on the board. You need to practice these things. So we need students need laptops for this. Tools, calculators for exams, Then also influence policies. Like I said, we're trying to work on our bill and our charter. We need help. We need you to speak about it, talk to your employers, and then put influence governments to help with this. So how do you get involved? You contact, we're going to put the email below. You send us an email, you scan the QR code below. There's a form where you can fill where you want to volunteer also. And then our social media handles are below. Please scan the forms. This is our email, our Instagram, our LinkedIn, and then our website address. Please scan the code, everyone. If you scan the code, you get asked questions of where you want to register. How do you want to register with NAS? How do you want to volunteer rather with NAS? Like I said, we need volunteers. We can't do it alone. Everyone here is volunteering. Everyone. Laura is here. Yvonne always volunteers for stuff. Mukami has volunteered for a lot of things, and I know that a lot of you are here. If you'll be at our gala night. We'll recognize everyone that has volunteered in one way or the other. But volunteer, please. We need a lot of volunteers. Like I said, we can't do it alone. We have very few council members who are always putting in their time for all of this. Yeah, so I'm going to leave it below, but I'll just say, something. And, the thing is, we always talk about, we need to grow the actuarial profession, we need to grow. But the thing is, change will not come if we wait for some other person or some other time. We are the ones that we have been waiting for. We have the change that we seek. We need to make this change ourselves. How do you do this? You volunteer, you try to influence policies, you do things, differently. And so let's continue to build, lead, and inspire together. Thank you very much, everyone. Do you have any questions? I know that but if you have questions also, you can... Okay, just one question. Yeah.
I stand on existing protocols. Please allow me to sit. Regarding, I would like to thank all the organizers because they are bringing in an evolution into both the industry, actuaries, and insurance. I formed an alumni group from my university, but in summary, we got calculators from SOE. And thank you for that. I learned one of the calculators can buy 2 computers. So I want to advise or plea with you that our universities are overtasked, and with what you have educated us now, we are the future of developing these 2 industries, both actuaries and insurance. So for us to teach effectively, I would suggest, if I'm not asking so much, maybe you organize something like a computer and then put in these softwares where we can go and facilitate more effectively on these models and on our teachings. Thank you very much.
Thank you so much. Thank you so much for your feedback. We will incorporate that. So like I said, I think we're fast spent, but if you have any questions, I'm here. I don't know, Toby and Juliet, if you can stand up. I'm sure many of you have heard of Juliet, but you have not seen her. This is Juliet and this is Toby. We work together in NAS. We are always stretched. So if you have any questions, please, you can contact myself, Juliet. You can contact Toby. Our president is here too. Please hold him. Jola, please let him see you. Also, I'm sorry, can I ask all the council members that are here to stand up? There's Ganiu, who's here also, please. So he's a council member, he's very helpful. Yeah, and Larry, I know many people know Larry, he's outside. Mila is a council member. Yeah, who else is here? Laura is a council member. She's a council member also. Yeah, so even people that are not within the council are very helpful also. Yeah, and so thank you so much. Also, you know, I just want to use this opportunity to appreciate our adjuncts. Francisco, if you can just stand up. Francisco is an adjunct in the University of Lagos Master's Program. Same thing with Jola Olu. Mela also. You know, so yeah, thank you so much for everything that you do. Yeah, have a great day.
Thank you so much, Ma.
So we've now got a coffee break, but the weather is really against us. So yesterday we had 2 coffee stations. Today we've got 1 because the other one wouldn't be able to survive the rain. It's quite floody outside, and so we'll have to go in stages. So if we could have our coffee in here and gradually, a few people at a time, go grab a coffee, that would be great. And be careful of the water as well because it will be a bit slippy. Thank you. Oh. Also, we need to start again at 11, so you've got about just over 15 minutes. Thank you.